Port of Spain General Hospital intends to continue a 24/7 service. It must be made very, very clear that even though we have been working under very trying circumstances for the last 4 years since the earthquake, we are not going to do anything to compromise what we currently do. So, just to make it clear, our accident and emergency service will continue as is. Similarly, the obstetrics and gynae department, so those patients who need to access those services, that is totally uninvolved in this current leveling exercise. Similarly, the autopsy and mortuary services. So really and truly, what is affected? Really and truly, in an effort to decrease the traffic through hospital from 1 p.m. when the actual process of leveling is taking place, we have adjusted the times in which the clinics start. So that clinics are now starting at 6 a.m. for the morning clinics and 9 a.m. If we can do that, and you come and you're seen in those periods of time, you're not changing any numbers or anything like that, it is hoped that by 11 a.m. you would have been seen and you have 2 hours in which to get your prescriptions filled. Individuals who may need to get their prescriptions filled outside of those hours will be able to access your prescriptions at the Oxford Health facility, which is just around the corner. Regarding how are we going to be managing this, okay? Because obviously we're going to be working on a little bit of trying, well, not a little bit, quite a bit of trying circumstances. But what we have been fortunate is that the Ministry of Health has been able to build for us in an attempt to expand our services from the earthquake, and have afforded us the 60-bed hospital or ward at the St. James Medical Complex. That means, therefore, to mitigate any type of overcrowding or circumstances in which we need to be able to use this, we will have the access to that. My staff has been deployed to cover the 2 areas. So what you may find, this is me, and this is something that what we hope to do, is that we're going to keep the most severely, critically ill patients present in hospital, deal with them, and as they stabilize, we will probably be moving some of them to St. James to continue your recovery and your treatment in hospital before you are discharged.